here at Vanderbilt, we were starting to use telehealth in kind of the 2019. It had been starting to become more of our clinical enterprise, because we see patients who may live 3, 4, 5 hours away. And we saw that as a way to minimize burden for patients. And then the COVID-19 pandemic hit, and this basically threw fuel on the fire of our telehealth. And it is not only accelerated telehealth, but it's also here to stay. We do, I think, about 20,000 telehealth visits every month, which is a substantial amount. And as we started to move into doing more telehealth appointments, conversations came up in our group of who are these appropriate for? Do these work well for everybody? Or should we be doing these only for follow-up? Are there particular types of patients? And what was really kind of a common thread across the concern was that our ability to effectively communicate with patients in the telehealth appointment setting. And so what we did was we wanted to compare exactly that. We wanted to compare quality of communication between telehealth appointments and inpatient appointments.
I would say the primary findings of this study were that telemedicine visits achieved high scores of shared decision-making and satisfaction. And then also in multivariate models, a telemedicine visit, when compared to an in-person visit, was not associated with quantitative scores of shared decision-making. And then we also identified some common themes from open-ended patient responses about telemedicine. And among these were convenience and usefulness and follow-up. But they also mentioned a lack of physical presence in the visits, as well as technical difficulties and mixed perspectives about the communication quality.